Okay. I'm your student nurse Alexandra Boozer from the University of Manitoba. How are you?
I'm good.
Okay, let me just verify. Please state your name, first name, last name.
Francesca Rubiso.
Thank you. So, you've been brought here for your high blood pressure. Is that correct?
Yeah, that's right.
What do you know about high blood pressure?
Well, I heard that term from my doctor. Well, it's high blood pressure. So like my blood pressure right now is about 44/90, which is high.
Okay.
Yeah.
So high blood pressure, the way it is that think of the hose.
Mhm.
You know, like how water is in the hose when you water your garden.
Yeah.
And think of the pressure of that hose being really high.
Okay.
That's what high blood pressure
That's
is.
what it's like. Okay.
Yeah. And sorry. Some factors that can contribute to this is family history, which you have, especially with your
Oh
father.
yeah, it's my dad. He had a stroke.
Yeah. And also with your diet.
Yeah.
Okay? So here's some
Okay.
more info on that. So in your understanding, high blood pressure is
High blood pressure.
yeah, so the pressure in your blood. That's
Yeah.
good. Okay, so some things can contribute to that. So as I said, diet. So there are some foods that you need to avoid with having high blood pressure. So according to your report, it says there that you like eating Jollibee fried chicken. Is that
yes.
correct?
Yeah.
Jollibee fried chicken is really high in salt. Why do you think salt can cause high blood pressure?
I'm not sure. Can you tell me?
Okay, so the way it works is that salt attracts water, and when there is water or the fluid going into your bloodstream, the pressure is going to be higher.
Okay.
Does that make sense?
Yeah, so
Can you
the water's gonna follow the salt that I'm taking in my body. That's why my blood pressure is increasing.
Yes, yes. So this can be found in processed meats such
Okay.
as bacon. That's very
high in sodium.
yes. And then obviously like chips, canned soups, any like condiments, and the fried chicken. So chicken in general is high in sodium, but especially the fried chicken. Okay, so those are just obviously some of the foods that you should avoid. But I've also done a little research that you like to obviously eat
My traditional Filipino food. Yeah.
Yes, yes, yes. So with the traditional Filipino food, I did notice it tends to contain a lot of sodium and fat. So that's like there's a lot of fried pork chops, and a lot they call lechon, which is a fried pork salty dish. So I found this pamphlet. It's called Ang Diet para sa Puso Mo, meaning diet for your heart. Yes. So we want to obviously have a good heart, because if our heart is maintained well, obviously then your blood pressure is maintained well too. So instead of fried chicken, we can try chicken tinola, which is basically like a soup with the veggies, and there is less sodium. Why do you think I would probably suggest something like that?
Well, first of all, it's not fried, so less sodium, like less salt, less fat too, and there's lots of veggies in chicken tinola.
Yeah.
Yeah.
And your blood pressure won't be as
high. Yeah.
Yes, that's correct. And then other things to look forward here is having more, instead of just having your white rice. Brown rice is also good, because having too much carbohydrates can also affect your cardiac health as it connects to diabetes.
Okay.
Yeah, and having diabetes can obviously be a problem to your vessels.
Okay.
Because of the sugar. Think of the sugar. It's causing damage, or we don't want to reach to that.
Okay.
So we want to look at
brown rice instead.
Yeah.
Okay.
So not just the salt, but as well as more balanced carbs, less bad fats, especially the saturated fats.
Well, this is really helpful and thoughtful of you. Thank you. Can I keep this? Take this home? Yeah.
Yes.
Oh yeah, and also I bought my medication here. The doctors gave to me hydralazine. Just to help decrease my blood pressure.
Yeah, so your thiazide, we call it thiazide.
Thiazide, okay.
Yes, so this is a diuretic medication. This means that it will work on your kidney and it will make you pee more.
Okay.
It's like with the hose, right? There's water.
Yeah.
We reduce that water, less pressure.
Okay, so I'm gonna pee lots with this medication, and
Yeah,
that's
you're
gonna
gonna
help
pee.
decrease my blood pressure.
Yes.
Okay, great.
And make sure to not miss the dose because complication is that you can, have a bounce back with the high blood pressure.
Okay.
Last is your BP cuff. You know how to use it?
Oh, this is to measure my blood pressure.
Just
I'm not familiar with it because I don't own a device.
just make sure to put it on your shoulder, wrap it, and press the button.
Okay, to measure my blood pressure myself, and I get to take this home.
Yes.
All right, thank you.
That's all for today.
Oh, thank you. It's very educational.